I've had the perio for a little over 5 years at this point. My long-term results that I've been seeing with those patients have been fantastic, similar to what we see in traditional periodontal surgical therapies. Patients who brush their teeth, take care of things, come in for frequent maintenance visits, they do really, really well, and their results are maintained for the long run. Those that don't follow that protocol, those that go back to smoking if they quit for a little while, those that are missing their maintenance visits or not taking care of their teeth the way they should be at home, they tend to slip back just like any periodontal patient would. But I'll tell you what, the results that we're able to achieve with the laser are equivalent or better to what we were able to do with traditional periodontal surgery. And if patients ever need to be retreated because they develop recurrent gum disease, they're not as adverse to doing it as they were with the old-fashioned way of doing things. The case that I treated was actually a single tooth on a retired oral surgeon in my town. And he came to me and he's like, I've got this pocket behind one tooth. He's like, I'm not sure I believe in this whole laser thing, but I want to give you a chance. And sure enough, we treated it. We grew bone in a vertical defect on the back of a molar. And he was a believer ever after that. So